In a moment of unprecedented tension between the scientific community and the political apparatus of the United States, over 1,900 researchers have united to issue a stark warning to the American public. This urgent plea comes in the wake of what they describe as relentless attacks on scientific knowledge methods and institutions, particularly under the current administration. The open letter signed by members of the National Academies of Sciences, Engineering, and Medicine emphasizes that the integrity of the nation's scientific enterprise is in jeopardy. "We see real danger in this moment," the letter states, highlighting the diverse political beliefs held by the signatories, yet uniting them in a common goal: to protect independent scientific inquiry. The researchers assert that the administration's actions are not merely political maneuvers but constitute a direct threat to public safety and the advancement of knowledge. They urge citizens to recognize the consequences of these attacks, which they believe could decimate the foundational structure of American science. The letter outlines a range of aggressive tactics employed by the Trump administration, including investigations into over 50 universities, which send a chilling message to academic institutions nationwide. The letter specifically mentions Columbia University, which was warned that federal funding would be withheld unless it implemented disciplinary policies against certain academic departments. Such actions not only destabilize higher education but also threaten vital research and innovation that depend on a supportive academic environment. Moreover, the administration has issued a series of executive orders that many critics decry as unconstitutional and detrimental to scientific progress. These orders have targeted a wide array of issues, from the rights of transgender individuals to the U.S. withdrawal from international agreements like the Paris Accord and the World Health Organization. The implications of these policies extend beyond academia, as they have led to a significant purge of diversity and equality initiatives within public institutions, including NASA's Artemis program, which was initially designed to include women and people of color in its lunar missions. Adding to these concerns is the role of technology mogul Elon Musk, whose so-called Department of Government Efficiency has reportedly cut essential services across influential scientific institutions. The National Oceanic and Atmospheric Administration has been particularly hard hit, with significant layoffs impacting crucial divisions responsible for monitoring weather phenomena and environmental hazards. This dismantling of scientific infrastructure raises alarms about the nation's readiness to face natural disasters and climate change. In an alarming twist, U.S. Secretary of Health and Human Services Robert F. Kennedy Jr. has also diverted resources from preparing for the next winter flu vaccine in favor of pursuing discredited theories linking vaccines to autism. This illustrates a broader pattern of neglecting public health in favor of political agendas, which could have dire repercussions for national health policies. The letter concludes with a rallying cry for the American people to act. "We urge the public to join this call," it states, encouraging citizens to share the message and engage with their representatives in Congress. The researchers emphasize that the voice of science must not be silenced, as the consequences of failing to protect scientific inquiry will affect everyone. In a separate but equally significant development, universities across the nation are finding innovative ways to engage the public with scientific knowledge. For instance, West Virginia University WVU is gaining recognition for its forensic and investigative science program, blending cutting-edge research and practical training to prepare students for impactful careers. The program not only emphasizes academic excellence but also addresses real-world needs in law enforcement and environmental analysis. Similarly, initiatives like the University of New Hampshire's Seacoast Sips of Science are breaking down barriers between scientists and the community. These informal gatherings allow researchers to share their work in relaxed settings, fostering a greater appreciation and understanding of science among the public. This grassroots approach to scientific outreach echoes historical traditions where scientific discoveries were discussed in public forums, making complex ideas accessible to a broader audience. As the scientific community grapples with these challenges, the outlook remains uncertain. The ongoing battle for the integrity of science in America underscores the need for vigilance and advocacy. The researchers' call to action highlights an urgent need for public engagement and support for scientific endeavors. The future of scientific inquiry and by extension public health and safety may very well depend on the collective response of society to these threats. As this story continues to unfold, the intersection of science, politics, and public interest will demand close attention and proactive engagement from both scientists and citizens alike. In a troubling turn for public health. Recent cuts at the U.S. Department of Health and Human Services (HHS) have raised alarms among experts who warn that the repercussions could severely undermine vaccine science and infectious disease policy. During a panel discussion at the American Public Health Association (APHA), experts lamented the implications of these layoffs, which they likened to an invasion aimed at dismantling critical public health infrastructures. Keynote speaker Dr. Paul Offit, a prominent figure in vaccine research at the Children's Hospital of Philadelphia, expressed deep concern over the HHS cuts, stating, "I feel like in some ways we've been invaded by a foreign nation, whose interest is to destroy public health agencies." His comments underscore the painful reality that the significant layoffs will lead to a considerable loss of institutional knowledge, which is essential for managing future public health crises. Offit highlighted the pivotal role that organizations like the Centers for Disease Control and Prevention (CDC), the National Institutes of Health (NIH), and the Food and Drug Administration (FDA) played during the COVID-19 pandemic, particularly in the rapid development and rollout of vaccines. He pointed to the foundational research of Dr. Catalin Carrico and Dr. Drew Weissman, which paved the way for mRNA vaccine technology, saving millions of lives. Because we were willing to spend money on research that at the time didn't seem to be necessarily relevant, when mRNA became incredibly relevant, it probably saved roughly 3 million lives, Offit stated, emphasizing the long-term benefits of sustained investment in public health research. Dr. Anand Parekh, Chief Medical Officer at the Bipartisan Policy Center, reflected on his experience at HHS, noting that historically, both Democratic and Republican administrations have supported a robust federal framework for vaccines and immunizations. The stakes are high, he warned, as ongoing measles outbreaks in various states have already resulted in fatalities among unvaccinated individuals. Public health officials like Casey Stoughton, Director of Public Health for Amarillo, Texas, have been grappling with the ramifications of these cuts while addressing a measles outbreak in her region. She stressed the importance of community engagement and cooperation among jurisdictions to combat the spread of vaccine-preventable diseases. The challenges facing public health initiatives are compounded by shifting public sentiment around vaccines. Researcher Dr. Gillian Steelfisher from the Harvard T.H. Chan School of Public Health noted an alarming trend in which fewer individuals view vaccine requirements for schools as beneficial. The conversation has moved away from safety concerns, she observed, attributing this shift largely to a growing emphasis on personal rights and choice. As a result, an unprecedented wave of vaccine-related bills has emerged in state legislatures, some of which aim to dismantle existing vaccination requirements. Dr. Michelle Fiscus, Chief Medical Officer of the Association of Immunization Managers, warned that while most of these bills are unlikely to pass, the few that do could severely hinder immunization programs, leading to lower vaccination rates and widening health disparities. In this tumultuous environment, experts are calling for a re-evaluation of communication strategies surrounding vaccines. Steelfisher emphasized the need to separate discussions on safety from personal freedom, advocating for more effective engagement with the public. "Everyone's in a fire hose of information all the time," she remarked, stressing the importance of trusted sources in disseminating accurate information. As the HHS undergoes significant changes under the leadership of Robert F. Kennedy Jr., who has expressed skepticism about vaccines, public health advocates face mounting challenges. The future of vaccine policy and public health initiatives hangs in the balance, with experts urging a renewed commitment to evidence-based science and public health education. Looking ahead, the interplay of these developments could reshape the landscape of vaccine science and public health policy in the U.S. The ongoing debates will likely influence not only the immediate response to infectious disease outbreaks but also the long-term strategies for safeguarding the health of future generations. The stakes could not be higher, and as the public health community navigates these tumultuous waters, the need for strong science-backed policies has never been clearer. I in the vibrant halls of the Massachusetts Institute of Technology (MIT), where creativity and scientific inquiry converge. Recent innovations are making significant strides in the realms of cancer detection and planetary defense. The latest developments not only highlight the institution's commitment to cutting-edge research but also reflect a broader trend in the integration of technology in healthcare. At the forefront of this endeavor is Kainan Dagdaviran and her Conformable Decoders group within the Media Lab, where they are pioneering life-saving wearable ultrasound devices designed for early breast cancer detection. This wearable technology represents a significant leap in how medical professionals can monitor and diagnose one of the most prevalent cancers affecting women today. Dagdaviran stated, "Our aim is to create seamless technology that empowers individuals with proactive health monitoring. Such advancements could transform patient care, allowing for earlier interventions and potentially improving outcomes for countless women." Simultaneously, the Self-Assembly Lab at MIT is working on making everyday objects from clothing to furniture smarter and more responsive to user needs. These innovations are not just theoretical. The lab's work has already influenced practical applications such as the methods and materials used by local businesses like Boston's Ministry of Supply. This blending of art, science, and practical application exemplifies MIT's ethos of fostering interdisciplinary collaboration to tackle complex challenges. Beyond the borders of MIT, significant strides are also being made in breast cancer research at the Mays Cancer Center at UT Health San Antonio. Dr. Patrick Sung, an expert in DNA repair mechanisms, is leading groundbreaking studies on the BRCA1 and BRCA2 genes, which play critical roles in maintaining cellular health. His recent work, supported by a substantial $12.6 million grant from the National Cancer Institute, aims to unravel the complexities of drug resistance in cancer treatments. Understanding the biological mechanisms behind drug resistance is crucial for identifying optimal treatment options, said Sung. His team's research not only sheds light on the genetic underpinnings of cancer but also paves the way for developing novel therapies that could revolutionize patient care. As breast cancer remains a leading health concern affecting 1 in 8 women in the U.S., the implications of such research are profound. The Mays Cancer Center, recognized as a National Cancer Institute designated facility, continues to push the envelope in translating laboratory discoveries into real-world applications. Dr. Jessica Trevino-Jones, a breast medical oncologist at the center, emphasizes the importance of personalized care and prevention strategies, stating, "Through preventative measures we can work to prevent cancer before it starts." While the research landscape is evolving, so too is the public discourse surrounding treatments for various ailments, including cancer. The recent resurgence of interest in ivermectin, initially popularized for its antiparasitic properties, has reignited debates about its efficacy in treating COVID-19 and cancer. Despite anecdotal claims and legislative moves to make ivermectin more accessible, scientific consensus remains clear: robust clinical trials have not substantiated its effectiveness in these areas. Experts warn that misinformation can undermine patient care and lead to harmful consequences. As the medical community continues to forge ahead with innovative treatments and technologies, the intersection of science, technology, and patient advocacy is more crucial than ever. The future looks promising, with institutions like MIT and Mays Cancer Center leading the charge in research that not only enhances our understanding of diseases like cancer but also directly impacts patient outcomes. The collaborations fostered in these environments are likely to yield groundbreaking advancements that will shape healthcare for generations to come. In a world increasingly shaped by technology, artificial intelligence (AI) stands out as a transformative force, particularly in addressing pressing societal issues. In a recent episode of Purdue University's podcast This is Purdue, Assistant Professor Alex Somas of the College of Science shared his groundbreaking work in leveraging AI to combat food insecurity, demonstrating the potential of technology to affect real change in communities. Somas, an expert in machine learning, explained how he and his team are using AI to match food donations with recipients efficiently. This initiative, in collaboration with the Indie Hunger Network, is designed to redirect edible food that would otherwise end up in landfills straight to food pantries. The Food Drop Initiative is about matching rejected food loads from truck drivers with food banks, SOMAS said. By automating this decision-making process, they aim to reduce waste and ensure that food reaches those in need more effectively. The numbers surrounding food insecurity in the United States paint a stark picture. According to the U.S. Department of Agriculture, food waste accounts for 30% to 40% of the food supply, while millions of Americans face hunger daily. SOMAS highlighted that about 40 million adults and 10 million children experienced food insecurity in 2022 alone. His work not only addresses this issue locally in Indiana but has the potential to scale nationally, allowing other organizations to adopt the open source code developed by his team. The goal is to expand and include more food banks, processing donations faster without the bottleneck of human decision-making, he noted. The episode captures Somas's journey from his childhood in Greece, where he developed an early interest in technology, to his current role at Purdue University. His passion for research and community engagement is evident as he discusses his mentoring approach, emphasizing the importance of fostering excitement in students about their research interests. The bottleneck in research is often not intelligence but desire. I believe in exposing students to a variety of topics and letting them choose what excites them, he explained. Purdue's commitment to interdisciplinary AI research is evident in initiatives like Purdue Computes, which aims to explore AI applications across various fields including agriculture, manufacturing, and healthcare. SOMAS remarked Purdue is at the forefront of AI research, with faculty collaborating across disciplines to tackle some of the most significant challenges of our time. As AI continues to evolve, ethical considerations remain paramount. SOMAS addressed concerns about fairness in AI decision-making, explaining that his models are designed to simulate democratic processes, ensuring equitable distribution of resources. By predicting how people would make decisions, we can create a system that reflects collective interests, he stated. Looking ahead, the future of AI at Purdue and beyond appears promising. With ongoing funding from organizations like the National Science Foundation and Google, SOMAS and his team are poised to expand their efforts in addressing food insecurity. As he concluded, AI is not going anywhere. Our lives will become more algorithmic, and it's crucial for us to understand how these tools can benefit society. Somas's work exemplifies the potential of AI as a force for good, reminding us that technology can be harnessed to solve some of humanity's greatest challenges. As institutions like Purdue lead the way in AI research, we can anticipate even more innovative solutions emerging to tackle pressing global issues in the years to come. The quest for efficient space travel has taken a monumental leap forward with the unveiling of a groundbreaking concept by UK startup Pulsar Fusion. Their ambitious project, dubbed Sunbird, aims to revolutionize interplanetary travel by utilizing nuclear fusion technology. If successful, this innovation could reduce journey times to Mars by an astonishing 50%, a prospect that has captured the attention of space enthusiasts and scientists alike. Richard Dinnan, CEO of Pulsar Fusion, articulated the rationale behind Sunbird, stating it's very unnatural to do fusion on Earth. Fusion doesn't want to work in an atmosphere. Space is a far more logical, sensible place to do fusion, because that's where it wants to happen anyway. The potential for fusion propulsion is staggering, with the capability to achieve speeds of up to 500,000 miles per hour, surpassing the record set by NASA's Parker Solar Probe, which reached 430,000 miles per hour. The Sunbird rocket proposes a unique approach to propulsion by waiting in orbit for spacecraft to latch on and then utilizing a fusion process that requires only grams of fuel, specifically deuterium and helium-3, while producing no radioactive waste. This method stands in stark contrast to conventional fission-based propulsion systems, which utilize heavier radioactive elements. By leveraging the fusion process which powers the star's, Sunbird aims to provide a cleaner and more efficient means of space travel. Currently, Sunbird is in the early stages of development, facing significant engineering challenges. Pulsar Fusion hopes to conduct its first fusion experiment in orbit by 2027. If realized, this technology could facilitate missions to Mars that would transport cargo in under 6 months, a remarkable reduction compared to current timelines. Additionally, the Sunbird could enable probe deployments to distant planets like Jupiter and Saturn in just a few years, potentially transforming our approach to space exploration. The advancements in nuclear fusion are not limited to pulsar fusion. Across the globe, various initiatives are underway to harness this powerful energy source. For instance, China's experimental advanced superconducting tokamak East, often referred to as the artificial sun, recently achieved a significant milestone by maintaining stable plasma for over 1,000 seconds. This achievement highlights the ongoing global pursuit of fusion technology, which promises a cleaner energy future without the byproducts associated with traditional nuclear fission. In the UK, the government has committed £20 million to bolster the domestic fusion energy sector, aiming to stimulate a further £100 million in investments. This strategic funding underscores the nation's ambition to remain at the forefront of the fusion race, aligning with global efforts such as the International Thermonuclear Experimental Reactor ITER project in France. Experts in the field such as Aaron Knoll from Imperial College London acknowledge the potential for fusion propulsion. He emphasizes that while achieving power generation through fusion on Earth may still be years away, utilizing it for spacecraft propulsion could be a viable alternative sooner. However, significant technical challenges remain, particularly in miniaturizing fusion reactor designs for space applications. Bhugna Srinivasan, a professor at the University of Washington, echoed this sentiment, noting that successful nuclear fusion propulsion could not only expedite human travel to the moon and beyond, but also facilitate resource gathering from celestial bodies such as helium-3 on the moon, which could be invaluable for future energy generation. The implications of harnessing fusion for space travel extend beyond mere efficiency. They represent a paradigm shift in our approach to interplanetary exploration. As advancements continue, the dream of utilizing fusion technology could enable humanity to explore further into the cosmos, unlocking new possibilities for scientific discovery and resource utilization. As Pulsar Fusion and other organizations push the boundaries of what is possible, the coming years will likely be critical in determining the feasibility of nuclear fusion propulsion in space travel. With ambitious goals set for 2027 and beyond, the world watches closely, eager to see if this technology can transform the future of space exploration and energy generation.